Hi, Kerry. It's Imran. I just wondered if I could ask you, how is this first phase of vaccinations going at Canalside so far? Could you give us a bit of a background?
Yeah, okay. It's going very well. Basically, I'm a practice manager at Bingley Medical Practice, one of the tenants here, and our primary care network consists of 5 GP practices, and fortunately I've got the role of coordinating them all together. So what we've done here, we've actually got the first wave of vaccines at Canalside Health Care Centre. It's gone really well. So far, we're vaccinating 320 people per day. When you look at some of the hospitals, they were doing 200 people per day. So we're really quite impressed with that. The process has gone quite well. It's quite slick. It has been quite tiring. A lot of energy and effort's gone into it. We do have an awful lot. We've made sure we had social distancing in place. We had labels on the floor. There's a whole range of staff. In essence, we've taken over one of the big meeting rooms upstairs. We've had like 4 jabbing stations, each with an administrator. So the patient will wander in, make sure they give them the name, we check all the details, get consent, the jab, and also the latest thing we had was a requirement that we had to hold them for 15 minutes. We had something like 24 hours notice to do that, so we just planned that in, and that goes quite well. So currently, you can say by Thursday, with 975 over 80-year-olds in the Bradford, also Bingley and Belden area, are on the road to a little bit of normality.
Excellent. And finally, is there anything that CHP can do to help to make this process better for the patients and staff?
We've had to be fair, we've liaised with it, obviously, with yourself, Imran, and I think it's gone swimmingly well. You know, we've had no issues, it's been sorted out, it's worked quite well. There's always going to be little bits we can do thinking about it, and it's been quite useful. I'm sure that I can only thank you, Imran, you know, for your support you've given us and everything else. It's gone well. We've kept you in the loop. We've spoken to you. I think we've got to look at the learning points. I think some of the learning points was that we had a huge chain of communication. You know, I mean, a lot of the times you'd wait till the CCG would then wait to talk to CHP, and I'll pick the mobile phone up and talk to you.
Absolutely.
So at least we knew we had that communication. Things were going on, and you made sure that. A good example of working together was there was some quite major scaffolding, some major works where you're going to put scaffolding up the stairs, and then you can stop that till the weekend. That's fine. I mean, and it's kept it flowing. We had lots of discussions about arrows and everything else, and it works. So I think we've probably come down to a few more signs. I think that's the only thing we need to do. But all I'm going to say, thank you, man.
Thank you for your time. Really appreciate it. Thank you.